Welcome to rePROs Fight Back, a podcast where we explore all things reproductive health, rights, and justice. I'm your host, Jenny Wetter, and I'll be helping you stay informed around issues like birth control, abortion, sex education, and LGBTQ issues, and much, much more. Giving you the tools you need to take action and fight back. Okay, let's dive in. Hi, everyone. I am excited for today's episode. We are going to talk about sexual and reproductive health and rights in Malawi. And joining me today, I am really excited to have two amazing experts from Malawi. And I'm going to let them introduce themselves so that you can learn more about them, but you can also know who's talking when. So who wants to go first? Emma, Brian? Let's do Emma. She's closest to me.
Okay. Thank you. My name is Emma Kaliya. I am the director of the Malawi Human Rights Resource Center, but I also chair the Coalition on the Prevention of Unsafe Abortion in Malawi. It is a grouping of civil society organizations, but also individuals who have passion for making sure that we do not have unsafe abortions in Malawi. I'm also very privileged to be the chairperson of a continental organization called FEMNET, a women's rights organization that works across Africa.
Wonderful. Brian?
And my name is Brian Ligomeka. I lead an organization in Malawi called Center for Solutions Journalism. Our organization specializes in promoting SRHR, sexual and reproductive health and rights, but we do so mostly using the media, hence the name Center for Solutions Journalism.
Wonderful. So I think before we get started, maybe we should do a little scene setting so people know. They might not know a lot about Malawi and what the SRHR landscape is. So why don't you tell us a little bit about what are the prevailing issues in Malawi right now?
Well, Malawi is a nation in Southern Africa. We're about 20 million people now there. There are a number of SRHR issues that are being discussed in Malawi. One of the problems, the obvious one, is the HIV and AIDS, which government and many stakeholders are trying to address through prevention and even provision of life-prolonging drugs, the ARVs. We are also fighting cervical cancer. We are fighting child marriages. And we are even promoting that women should deliver in hospitals instead of going to traditional attendance. Of late, one of the hot issues is about the need for government to enact what we call termination of pregnancy bill, because at the moment we are using an outdated colonial law on abortion. So I think those are some of the things. I think my colleague can add the things that I may have skipped.
Yeah, we just add the issue of maternal mortality.
Okay.
Which is still a big problem. Of course, we've improved from where we were. In the old days, we would be talking of 1,120 women dying when there are 100,000 live births. It has, of course, reduced now to about 434, 439 women dying. And that is a huge problem, but because also it is the whole issue of the systems, the health systems that are overstretched, and certain things would have been preventable, but at times we end up losing lives.
Yeah, and I think also I had heard you talk about before gender-based violence also being a large issue in Malawi.
Yes, it still remains a big issue like it is in many countries. Malawi did enact a law on prevention of domestic violence in 2006, realizing the magnitude of the problem. At that particular time, we thought maybe when we have a lot of things will improve. There has been, of course, a lot of progress in terms of awareness, but we are still seeing gender-based violence, which would include intimate partner, sexual violence, and many other things that at this time you tend to look back and say, are we going anywhere, or this problem has come to stay? So yes, it still remains one of our big problems in Malawi.
And you're right, that's one of those kind of universal everywhere problems.
Yeah, yes.
So one of the things we've talked about on this podcast before is the role of U.S. global health assistance. So is U.S. global health assistance in Malawi, is it helpful? Is it hurting? Is it a mixture of both because of U.S. policy?
Well, I would say that most Malawians, including myself, appreciate the assistance that the U.S. government is actually channeling or giving Malawi. We have been utilizing that assistance, and it has helped actually Malawi make some achievements and strides. But some of the new policies that have come into place are affecting the deliverables of the same assistance. One of the policies being the Mexico City policy or the global gag rule, which instead of achieving its intended purpose, to some of us, when we analyze it, is not achieving its intended purpose. At the moment, courtesy of that global gag rule, unsafe abortions in some parts of Malawi are on the increase because some of the service providers which were advocating for prevention of unsafe abortion are closing shop or scaling down their operations because funding has been withdrawn from them. The reason being that they are seen as if they are promoting abortion as a method of family planning. But the truth is that is not the case in Malawi. Abortion in Malawi is performed to save the life of women or girls who are in danger. So what is happening is that there is an over-implementation of the global gag rule, and it has consequences like the increase of unsafe abortions, which are resulting in many complications, and some cases they result in deaths of girls and women. The same global gag rule is also impacting on the policies and laws that Malawi government is reviewing and enacting. A shining example is what we call termination of pregnancy bill. Malawi government started enacting that bill, but when the current president of US, the United States, came into power and introduced the global gag rule, progress in the enactment of the termination of pregnancy bill in Malawi has stalled. Nobody wants to point fingers at the US government, but you can read the big signs that it has that influence.
An addition as well is the whole issue of the US government, maybe other governments saying, especially the US government with the GGR, we have not reduced funding. The aid remains the same. But like my colleague is saying, if the funding is the same, where does that money go? Does it really go to address some of the issues, especially around the global health? Does that money address the issues of global health or in Malawi? Or it is diverted to other things because those that were supposed to be receiving that money cannot receive anymore? There is a clear example in Malawi where an organization was implementing some services or was providing health services in certain areas, rural areas. But when this GGR came, it was a choice between you continue with this work or you drop the other funding that you have that is towards issues of abortion. And therefore, this organization chose to continue with the other things because maybe for them it was about the values that they were standing for. That meant taking away those resources. The report is very clear on that. Those resources and putting them in an organization that had no idea of service provision at all. And therefore, those communities that were benefiting from any kind of general health services were affected. So the mere transferring of money to go to this organization did not, in the end, serve the same purpose. So the aid may remain the same, but if those who have expertise in that area tend to withdraw and say, stay with your money as we are going to go do the other things that we've been doing, it may entail that we are creating a gap and that money may in the end not produce any particular result. And hence, we feel that we are grateful, we receive this money at bilateral level, but does it really reach out to the intended purpose, especially because of this GGR? So maybe before it was okay, but with the coming in of GGR, while the justification remains, we are bringing aid to Malawi, but it is the way that aid now is being used.
Yeah, it's really hard when you have providers that the community trusts, that they have been going to, that are no longer able to provide the services. There might not be someone who is easily taking over the services, and definitely maybe not someone that the community already trusts to go to access, the allowed services.
Yes. It's obvious. There are two things. Just the trust that you are talking about. You have a new person in place. These people do not even know these kinds of people that have come. They are not sure they have come to do what, because they were so used to the other group. At the same time, even communities are questioning, are these people really serving our needs, or they are serving the needs of somewhere? Because we do not understand. Those people in the communities may not understand the GGR. For them, they only know that we need to receive a service. So when there is withdrawal of people or institutions that have been doing good work, at the end of it all, for them, they do not know even that there is America behind that. What they only know is that our government should have been providing what. But then the government is mum. He cannot say anything to these people because they know that maybe a big brother somewhere is controlling using a remote control. So complexity and trust is lost. Next time you see another institution coming, people are not sure. They simply say, no, we do not know these people and we cannot be at their facility. We would rather just stay. And people just end up dying in the villages.
Well, yeah.
As a matter of fact, there are even some worst cases where you had a clinic, a service provider who was providing services to the community, and because you have discontinued funding to that service provider has closed the clinic, and you take the money that was being given to this service provider, you give it to a non-service provider. So it's the community that is suffering, because you have given the money to an advocacy group, but that group cannot provide productive health services which people in that community were enjoying when the service provider was in operation. So there are those worst cases where you had a clinic And the clinic has now been closed because of lack of support, which previously was being provided by the US government.
Yeah, and I think, we touched on it a little bit, like, this isn't just people aren't able to get, just basic services. These are people's lives, and people's are getting unsafe abortions. They may not be able to access a full range of care, other care, and that you're seeing women dying.
Yes. This we keep repeating to say, do you really have to wait for people to come for post-abortion care? Or you can prevent, whether through messages, through certain help, like it is in Malawi now, it is a helpless situation. I have said it time and again that until my own child, my own sister, my own cousin, who is a woman, dies, then I can start understanding. People do not understand the impact of such deaths. You had somebody in the morning, in the afternoon, they are telling you that person has died because they went procure an unsafe abortion. And therefore, with these kinds of situations, when we are speaking on things that we see in our communities, that do you really want to save this money so that when you save it, you can attend to post-abortal care, which is not also usually available, like you've said. In rural areas of Malawi, people have to travel long distance. At times, accessibility of even ambulances is not there. Maybe the actual ambulance is not even there to go and pick this person. So they die silently in their villages. Nobody will know. There will not even be entered statistics to show that in that village today, somebody has died of this. And therefore, it just goes unreported. And for countries like the US, people are so far from us. At times, they do not understand the impact of some of these things that happen far away from us. But in the villages, as we stay there, we know how dire the situation is in our communities. So it is true that people continue dying and that we take policies to be more important than the lives of people. And it doesn't matter because it is not happening in my home. It is not happening in my country. At the same time, there is money that goes there, taxpayers' money, that should have gone, if it goes there, it has to do proper purpose. It has to be used for purposes that would save lives of people if we are talking about a global health.
So I was lucky enough to hear you to speak at an event yesterday, and you were able to tell some stories from people that have been affected by the policies. Do you maybe want to, I think one way to get people to really understand what is happening is to tell stories. Do you have something you would like to share?
Yeah, this is something that happened outside the city of Blantyre, where actually I stay. There was a girl who was raped. She was 16. And when this girl was raped, she became pregnant. And after becoming pregnant, she wanted to access the service. Unfortunately, the facility that was offering the service in the area was closed due to global gag rule. And this desperate girl had no alternative but to go to a traditional herbalist who administered a concoction to some herbs to this girl. Unfortunately, the girl started bleeding. Then she died. This is why to some of us, in the US, you can call abortion as, you can call the global gag, you can say it's global gag rule or Mexico City policy. But in rural areas in Malawi, the global gag rule is actually a death sentence to poor, illiterate women who cannot access a service, because the clinic that was operating in their area has been closed. The problem is with the conditions set by the US government. Even if that poor girl who was raped had gone to a government hospital, should have been turned away, should have been told that she could not terminate her pregnancy, because in Malawi, provision of abortion is only restricted to save the life of a woman who is in danger. So we wanted to address that even when girls and women are raped, they should be able to access service. But the global gag rule has even affected the abortion law reform in Malawi. So, yeah, in simpler terms, let's talk about the global gag rule in the boardrooms. But when we go to the villages, we are talking about the deaths that are emanating from unsafe abortions. Because minors who are pregnant as a result of sexual assaults cannot even access a service in the government, because either the service provider is not there, or where the public service provider is there is not providing the service in the name of abortion is illegal in Malawi. And when we wanted it to make it legal for these women and girls who have been raped, you find that a police in Washington, D.C. has even sent shivers amongst the bureaucracy in Malawi, who have now slowed down on the law reform process.
Yeah, I want to make an addition. We always say that minors are those that are below the age of 18. But we wonder how you can allow a minor to have a child just because she's been raped, or she's been defiled, actually, not even raping, because the rape goes to over 18. So then you say, because in Malawi, we cannot provide this service, so we're allowing children to have fellow children, which is very sad. The same people, we call them minors. The same people who have fellow minors, keeping fellow minors. How can a minor have a child and keep that child all the time? Their life is ruined. And that's where, we are speaking so much to say we should not allow this, because it's breeding a society that at the end of it all, we cannot even be able to support it. Secondly, the governments like the government of America, the state government, would be saying, and many people say that, even in Malawi, they say, after all, people are lying that abortion contributes to the maternal deaths. But there is evidence that it is 18% of maternal deaths in Malawi. It is because of unsafe abortion, complications of unsafe abortion. And really, in countries like the US, one death is already enough. And us, we are talking 18% of those that die from the 439 that I talked about. 18% of that are dying from unsafe abortion, which should have been prevented. And then we are saying it is okay because they are dying in the name of maternal death, when we didn't know the reason why they are dying. Because if they would have been dying because it was not the issue of abortion, maybe it was complication of delivery, so there was no ambulance to take them. You could justify those things. Maybe they would be understood. But things that are preventable, and then we allow them to happen, and then we justify them in the name of maternal death, even for children and for adults, putting them together and saying women die of birth complications when we didn't know why they are dying. That's where it becomes quite unfortunate.
Yeah, I think it's so important because so often we just talk about the policy as a thing, just like separate from the reality of the lived experience on the ground. And it's so important to hear from people in country who are experiencing the effects of it and to hear how it is impacting people's daily lives and that people are dying. And I think that gets lost so often when we talk about it being a bad policy, is not focusing on the people. Okay, so we always like to end with like an ask, but I think today would be really good to talk about what would you like to say to the U.S. government on behalf of SRHR advocates in Malawi?
The message is straightforward. The global gag rule should be reviewed and at best repealed. You cannot celebrate that you have a policy which is sending women to their early graves. You cannot. You might not see it because you are at a distance. But we, as the citizens who have been living in a country which has been benefiting from global health assistance, we are seeing that a policy has been made which has now turned the same assistance into a weapon of destruction. Appeal to the government in the United States, to the administrators, even to the president and his entire team of the cabinet to review the policy. This policy is not achieving its objectives. When the American government is giving assistance to countries, the aim is to ensure that those countries are improving a number of their indicators in the economy, in the health sector, in agriculture. But when you are pumping aid to a nation and that aid is not achieving its intended objectives, then you need to review some of the challenges that actually is making that aid ineffective. And in the health sector, one of the challenges is that the global gag rule has that negative impact. It is increasing unsafe abortions in Africa instead of reducing them. It is responsible for the death of women and girls instead of improving the health and livelihood of girls and women.
Yeah, I have always wondered myself. We tend to compare at home to say, when they introduced the male circumcision, the resistance was just very short. Later on, everybody was running everywhere. Anything to do with benefits of men is not an issue. Anything to do with women, it takes so much time for many people, including policymakers who have daughters, who have wives, who have mothers who brought them into this world, to understand that it is a violation of rights. Many times, women's rights are taken like charity. They are not taken as substantive rights like we would say a right to vote. You put on a scale, a right to vote becomes even heavier than a right to a woman. So even if a woman dies, it doesn't matter provided we are voting. When we talk about issues of economy, if it is a bill to do with money, economy, it will be passed within the shortest period of time. We've seen this at home, where bills that work towards the improvement of lives of women takes 10 years before they can even consider passing them. But when it is something to do with money, it will be the following day. It will be in the parliament, they will discuss it quickly, and it will pass. And then you wonder, are women human beings? Or they are not human beings? Or they are second-class citizens? And that is the question that keeps coming back to me to say, why are we treated like second-class citizens? Those who are in the villages, people think they don't contribute anything to development. If we did not have people in the rural areas, development of our countries should have gone down. If we did not have women contributing in whatever way, the care work and any other sector, our countries would never have developed. It is the same women that toil day in, day out. And really, why you do not just want to accept that women need to have to enjoy their rights in full, and like restricting their rights. And this is the question for bigger member states like the US that is putting in so much resources in the name of, like my colleague has said, helping poor countries. Malawi is one of the poorest countries. And when our government is sitting back, failing to speak, remaining mum, we are not surprised because they know if they touch this big brother, they just try to provoke the big brother. At times it can have, adverse effects in terms of our developmental agenda. Many things will stop because there's money that goes into Malawi as aid. Money comes from other countries contributing to our budget, and therefore they would rather just keep quiet and look and see their people dying. So really it is a big concern. The straight message is that my colleague has said, kindly reconsider this position. The people of America, while yes, we talk of the president, but the people of America should start understanding they are very far from us. There are certain things they may not know. Start understanding that you need also in your own way convince the government in America that they cannot continue on this path. The reign is not the right reign. They need to take a position which would be meaningful to those that are helping out there, because we consider this is taxpayers' money in Malawi, in here, that should really help people out there in a meaningful way.
Emma, that amazing answer reminded me of one more thing I wanted to ask you about. And that is, lately in the U.S., the administration has really been pushing programs around women's economic empowerment. I feel like maybe we should have a little conversation about women's economic empowerment without reproductive rights.
Yes, there are two issues. I think it is easy to talk about economic empowerment. So many programs are introduced. At times I ask myself, they go micro. At times they are not even macro. And economic empowerment in our countries, which goes too micro, will just be serving the purpose of day-to-day survival. And it does not change the economic status of women. We are saying they need to introduce programs that would really change the status of women. And connected to SRHR, if we believe that economic empowerment changes the way issues of GBV are viewed, then I think we seem to be missing the point, because as I'm sitting here, a woman of my caliber, in an office, I have a big car I'm driving, but go inside there, you discover that there's so much intimate partner violence. But even in the offices, you are facing workplace violence, gender-based violence, and you are wondering, this woman is economically empowered. Why is it that she's also facing the same violence that is hidden? Because they also get ashamed to speak about it because they know that out there people think that they are economically empowered. Some of the issues of SRHR that come out, like one of the issues that my colleagues mentioned, even issues of unsafe abortion, are happening within the context of economic empowerment that we are talking about. And then out there, you seem to be a woman with standards, but inside, there are certain things that are forced on you that you do not even avoid, but you are economically empowered in terms of money. But in the mind, it is different. So issues are connected to SRHR. For some of us are saying, one, we need to find better programs to educate people, even those that are in good jobs, even those that are earning more, so that they are able also to view issues of SRHR in a very understandable way. So they understand, they connect things properly, they also interpret the implications of so many health issues in their own right. Otherwise, the issue of economic empowerment remains empty if there is no proper education, because many people can go to school, but they do not understand these other things that can affect their personal lives. So yes, but American government is introducing so many programs. I know in Malawi, so many programs about economic empowerment. As I'm talking now, is it not the government of America, that it is EU or government of America that has given so much money to the agriculture sector, wanting to do small things for women, but the small things for me do not, to me personally, I find them not meaningful. I have to end with this example. A woman in the house is given a business of chickens. So she's rearing chickens. And then tomorrow morning, the husband says, there's no food here. What will she do? She will take the same chickens and use them for food. The business ends there. They should make sure we are investing in bigger things that would be aimed at changing the status quo, and not recycling the same things, and then people remain in a vicious circle of poverty, so that we are still justifying aid in the name of people are poor when we did not manage the other aid properly. So I think that's the way I see things myself.
But it is also important to note that sometimes it's good to deal with the basics. And the basics include food availability, shelter, and good health. These are three basics that should be dealt with. You cannot jump to economic empowerment before you deal with issues of health, food, and shelter. Then you are missing the point, because you cannot empower a woman or a girl who has died from unsafe abortion. So, issues of health should be addressed as a basic need, shelter addressed as a basic need, food addressed as a basic need. Once these basics have been addressed, then we will graduate into the next level. Why should you jump into the third tier when things in the first tier are in a mess? So you cannot achieve economic empowerment if you do not address the basics, the basic things that people need. Issues of homelessness should be addressed. Issues of food availability should be addressed. Issues of access to health services should be addressed. But the moment that you say, we will skip the food, we will skip the shelter, we will skip access to good health services, and we will go to the higher level needs like economic empowerment, then you are not doing things in a logical order, and you will not even achieve the economic empowerment that you dream about. It's a wrong way to do things. It's a wrong way to do things. So why should government choose a wrong way to do things when there is a logical way to do things that can make people progress from poverty to economic empowerment that is there? So I think that's my contribution. If you don't address the basics, women will be dying, girls will be dying, people will be dying. So who will you empower? Will you empower people who are in the grave? That's my contribution, that health is one of the basic needs that ought to be addressed. When the basics have been addressed, it's when now you go to look at things that are at the next level.
There's an addition to that. Maybe I may have missed it. Yeah, Malawi also is suffering from issues of malaria. Many people are dying because of malaria. And malaria, in some countries, they have dealt with it once and for all. We receive a lot of money around issues of addressing issues of malaria. I get a bit upset myself because I feel like, why is it that other countries have dealt away with issues of malaria, but we are still being made to receive mosquito nets in the villages where they don't even have a bed, so they put it on the mat and it gets damaged the same day you receive it. We are still made to receive drugs that are not good at all. They make you even more sick. So for poor people who have no food, like my colleague has said, these things are taken like he said, basic. These rights. So until those that support us understand that all these things that we are talking about are issues of rights, they are not issues of saying, okay, it is okay, maybe tomorrow. They are not issues of charity, and that our governments have an obligation. The development aid that comes, or those that are giving aid, should have a responsibility as well to making sure that we are moving steps. We are not going back and forth, moving two steps, one step forward and two steps behind, addressing the same issues that we were addressing 10 years ago. I think, like he said, we need to reflect and say, how best can we address? Malawi is a poor country. We have so many other things that have to happen. We can invest in issues of education. We can invest in issues of health. We should not be addressing the same issues we have been addressing for the past 10 years. This should be completely avoided because it's like, again, we are moving on a roundabout. We are not going anywhere but round and round, and we don't seem to know which direction we are taking. So I think that is my contribution as well, just to add on what he has said, that I think we have more to do than what we see.
Emma, Brian, thank you so much for doing this. It has been a pleasure to talk to you.
Thank you so much.
For more information, including show notes from this episode and previous episodes, please visit us at our website at reprosfightback.com. You can also find us on Facebook and Twitter at rePROs Fight Back and on Instagram at reprosfb. If you like our show, please help others find it by sharing it with your friends, and please rate and review us on Apple Podcasts. Thanks for listening.